questions from the press. First, we'll hear from the Minister of Health. Minister?
Good afternoon. The Ministry of Health received 1,339 test results since the last update, and 81 were positive for COVID-19. One of the new cases is classified as imported by a non-resident who arrived on the British Airways flight BA2233 from London on the 4th of March, 2021, and tested positive on their day 14 test. 35 of the new cases are classified as local transmission with a known contact, as they are associated with known cases. The additional 45 new cases are classified as under investigation. These cases are among residents with no currently identified link to other known cases or a history of travel in the past 14 days. Additionally, since the last update, there were no recoveries. There are currently 294 active cases, of which 293 are under public health monitoring, and one is in hospital with none in critical care. Since March of 2020, Bermuda has recorded 1,028 total confirmed cases of COVID-19, and out of these, 722 persons have recovered and 12 persons have sadly succumbed to COVID-19. The mean age of all confirmed positive cases is 40 years of age, and the median is 38, and the age ranges from less than 1 year to greater than 100 years. And the mean age of all of our currently active cases is 33 years, with the median age being 34 years. And the ages range from less than 10 years to greater than 80 years. Details will not be provided for the hospitalized case to protect privacy and confidentiality. The mean age of all deceased cases is 75 years, with the median age being 77 years. And the ages range from less than 60 years to greater than 80 years. The source of all cases is as follows. 239 are imported, 676 are classified as local transmission, of which 584 are local transmission with a known contact or source, and 92 are local transmission with an unknown contact or source, and 113 are under investigation. As investigations proceed, transmission categories may change. Of the over 190,000 test results reported, the mean age of all persons tested is 43 years, with the median 42, and the ages range from less than 1 year to greater than 100 years. The 7-day average of our real production number is above 1, and Bermuda's current country status remains as sporadic cases as determined by the World Health Organization, and community transmission as determined by the Pan American Health Organization. Bermuda, this is a significant outbreak. We have never experienced community spread. Sporadic cases means having few cases, which may be imported or locally acquired. However, community transmission signifies outbreaks where it is difficult to relate confirmed cases through chains of transmission for large number of cases, or there are widely dispersed cases detected in the past 14 days. Bermuda exhibits signs of both of these situations, and this is new territory for us. It is more critical than ever that we take responsibility for our own behavior and act in an abundance of caution. In other words, stay in your household bubble. Do not socialize outside of your household or invite others into your household. Do not mix households, as we know this is what is contributing to our spread and our current outbreak. I know that this sounds punitive and not welcoming news at all, but we are all in this together, and we have to recognize that we have a very, very serious problem, and we all need to be part of the solution. Everyone must do their best to prevent further spread and prevent more critical illness and death from this third wave, which is presently on track to be larger than the second wave because of the UK variant spreads easily and is spreading incredibly fast throughout our community. If you have not already done so, we need you to download the We Health app, which is designed to help slow the spread of COVID-19 by anonymously notifying app users of potential exposure to COVID-19. Everyone should continue to wear a mask, physically distance, and practice good hand hygiene, especially if you are in quarantine and unable to be separate from others in the same household. These are first principles of containment and must be practiced at all times by everyone. Also, Be aware of the symptoms. We are finding most symptoms associated with the UK variant of this virus are easily associated with allergies, such as sore throat, tiredness and headaches, coughing, and sneezing. The Ministry of Health has 2 new walk-ins and drive-in pop-up locations this week that will offer COVID-19 testing to the community. You do not need an appointment to get tested. And these locations and the details are as follows. At TCD through the outdoor drive-through lanes on Monday, the 29th of March, and Wednesday, the 31st of March, between the hours of 5:30 and 7:30 p.m. And at Horseshoe Bay Beach Car Park on Monday, the 5th of April, and Wednesday, the 7th of April, from 4:30 to 7:30 p.m. We are making it easy for people to get tested. These new pop-up testing locations are safe, quick, and convenient, as we are meeting people where they are to make it easier for persons to get tested. I encourage persons to get tested so that they know their COVID status, especially now as we have this very aggressive variant and we are seeing an increase in positive cases. Both walk-ins and drive-through testing will be offered at TCD, while only walk-in testing will be offered at the Horseshoe Bay Beach Car Park. If you are experiencing any symptoms, please contact your doctor. Your doctor will schedule you or direct you to the COVID-19 helpline at 444-2498 for symptomatic testing appointment slots. The test locations for travelers only are PROT Post Office Monday to Saturday and Sundays at Penno's Wharf. Testing times are emailed to travelers and operating hours depend on traveler demand. Before closing, my key message to everyone is stay in your bubble. Do not socialize and avoid contact with those outside of your immediate family. Get tested and get vaccinated when it's your turn. And please follow the guidance and obey the restrictions that are in place. We are having to put more restrictive measures in place to minimize COVID-19 transmission by limiting our social movements. We have said numerous times, this is all preventable if we can all do our part, have patience, and do everything that we can to prevent the spread of COVID-19. As I said last Tuesday, we will get through this current challenge, and I'm grateful to all of those dedicated healthcare professionals who are working tirelessly to fight the pandemic and keep us safe. Thank you.
Thank you, Minister. And I would certainly like to echo your comments of thanks to you, to your team, and to all the teams that make our healthcare system, who are so vital to our success in beating the coronavirus. Together, we must do all we can to ensure that you and your teams are protected and to do our best from to ensuring that your teams do not become overwhelmed and keep our resources from being stretched any further. Certainly, the number of 81 is stretching your teams and the ability to make sure that we can contact trace. And I want to just thank you for your work, your dedication, and the outstanding perseverance that you, the team that's led by you, continue to show this country. It would be an understatement, Bermuda, to say that it is disheartening for us to be where we are. 2021 is still a year that continues to hold some promise of an improved economic situation, and this current setback is one from which we will recover. There is a clear path to that recovery, and it starts with a renewed and unified effort to mitigate the risk presented by this increase in positive cases, which are a result of this new, dangerous, and incredibly transmissible variant. We laid out indicators where necessary, we could systematically roll back measures to reduce the virus transmission. The stricter measures that will be adopted are designed not only to protect, but to preserve the basic progress we all made over this last year. This UK variant is a strain that has caused many other countries to suffer a slowdown in the fight against the coronavirus. Our island is at a serious juncture. Our public health system is being significantly challenged. The teams are struggling to keep up with contact tracing, struggling to keep up with the work which is necessary in order to control this outbreak. And the severity of this outbreak and its impact on individuals and our healthcare system can be further magnified if we do not arrest its current spread. Our first duty as a government is to do what is in the best interest of the island and her people. And that responsibility cannot be tempered by convenience, frustration, or fatigue. We are unwavering in our determination to keep Bermuda safe and to strike the necessary balance to preserve life and to ensure our economic survival. Therefore, earlier today, the Cabinet met and decided the following changes to the public health emergency regulations, which will come into effect at 6 a.m. tomorrow, March 28th. First, churches and indoor religious services, save for funerals, are closed to congregants, but open for a max of 10 clergy or those persons required to facilitate services for broadcasts. Indoor dining is prohibited, save for hotels whose indoor dining is restricted to hotel guests only. Indoor gyms are to be closed, as well as bowling alleys, indoor cinemas, museums, or any other indoor place of public resort. Retail stores will be restricted to 20% of capacity. To minimize the mixing of school-aged children, of where we have seen a significant level of cases, schools and camps are to be closed. In addition, remote working will now be mandatory where at all possible. All the regulations that were in place previously will remain in place. The curfew will remain from 11 p.m. to 5 a.m. Simply put, indoor activities that require you to remove a mask are not allowed. For Christians, tomorrow begins Holy Week, the culmination of Lent, and a period of sacrifice and preparation. Again this year, it would appear that traditional celebrations will be impacted, and we will have to avoid large family gatherings that often accompany this season. But in the midst of what is a difficult period, we must continue to have hope. We have seen what happens when we follow public health guidelines. We know how effective it is when we protect our most vulnerable. The unity of the last year was no accident and is not some distant memory. Our collective compliance is what got us in sight of a change in this pandemic, and I'm confident that with the status of our vaccination program and with cooperation of the entire country, we will have it again. My message to all echoes precisely what the Minister of Health says. As much as possible, stay at home and stay in your family bubbles. We will, over the coming days, look at what adjustments may be necessary to these restrictions. But at a broad level, now is the time for a shift in behavior. This situation is very serious, and we must all take personal responsibility for our actions and collective responsibility as a community to protect our brave frontline healthcare workers. We must be vigilant and use what we have at our disposal. We have the tools to keep the virus at bay, but the only thing that will help us all is if we all follow the rules and stay at home. We will have more details on Tuesday at our press conference, but now there is only one simple message before we take questions from members of the media. We need people to remain at home. Thank you, and I'm happy to take any questions from the members of the media at this time.
Good evening, Premier. We'll start with Bermuda Broadcasting, and Don Burgess will be joining us momentarily.
All the rules.
Don Burgess, you're live.
We will have more details on.
Don, go ahead.
Oh, I'm sorry. There's a little bit of a delay. There was widespread testing at the correction facilities on Thursday. How many people tested positive?
Don, I do not have that information with me insofar as the test results of the Westgate testing program the other day. I don't have that in front of me, I'm afraid, and I'm at my home as opposed to the office, so I do not have that. I don't know if the CMO has that, but I can certainly endeavor to get that information to you.
CMO, do you have that information?
Well, I know that the testing captured most of the inmates. There are a couple who would not have had it. So at the last count, we knew there were 5 people who were tested positive. We were looking at the rest of the inmates and staff and officers who had not been tested this week. So that we'll have a clearer picture by Monday.
Okay, thank you. Mr. Premier, you mentioned again the We Health app. It doesn't seem like it's helped this much during this wave. What proof do we have that it's actually hurt the numbers some?
We do know that individuals have contacted the Ministry of Health for contact tracing purposes because they've gotten an anonymous notification from the We Health app. So that means that it is working. It is doing what is sold. The challenge that we have in this particular outbreak is not necessarily the We Health app not working. The challenge is that this variant, as I think the CMO discussed on your newscast for Bermuda Broadcasting last evening, is that this variant is different. So in previous cases and instances where if there was a case in a workplace and there's 10 people in the office, you may find 1 or 2 people that are positive. Now we're finding 7 or 8 people that are positive. In individual households of 4, where maybe there would 1 person, he would test the entire house and maybe 1 person. Now we're finding entire households that are positive. So it is spreading more quickly. And so the restrictions that are being put into place are to arrest that spread, because the most important thing is to make sure that the Minister of Health and the CMO's team are able to continue to combat this virus and to make sure they can keep up with the contact tracing and the testing, which is necessarily required. So we have to reduce our interactions. We're seeing significant workplace spread, which is the reason why we have told everyone, unless your job is outside and requires you to start hammering nails and other types of things, it is restrictions to stay home and work from home.
Okay. Bermuda Broadcasting has heard that a number of people who've had both vaccinations have tested positive with COVID-19. Is government keeping track of this? And if yes, how many people fall into this category?
Hi, Don. Yeah, we are keeping track of this. It's, as you can appreciate, it's a moving feast. There's so many variables to this, but we're keeping track of it. As I mentioned on Tuesday, and it still remains the case that the people who have tested positive after vaccination, for in the large majority of cases, actually have either no symptoms or mild symptoms, and their test values show that they have very mild disease. There are some interesting cases that we do need to investigate further because it's not consistent with what we found. Too early to give you any details around that now.
Okay, but do we have any numbers of the number of people who fall into that category?
I would not like to give a number because that is a very variable thing, and I don't have full confidence that we're able to capture everything at the moment. So there's work going on as we speak to make sure that the systems talk to each other and we have confidence in the numbers that we have.
Mm-hmm. And Don, I think it's just important to note, as in Tuesday's press conference, that we stated that this is not abnormal. And I think it's a very key point, because I know there's people in the population that are saying, oh, the vaccine doesn't work. No, that is not the case. The case is that the vaccine does work, and the results are showing and proving that there is reduced viral load, reduced things, and reduced symptoms. And also the as evidence is showing of possible reduced transmission. But what the CMO will be give further details. The key point is that it does not prevent infection, but it does prevent possible onward transmission and getting sick, or reduce that. And what we're looking to do in all public health measures is the reduction of transmission. Reduction of transmission, our number goes below 1, the numbers go down. Our number is above 1, the numbers go up. And that's why it's key and critical to continue where we are.
How many people are under quarantine? This would include people who are living in their dwelling.
Yeah, Don, it's a large number, and it's changing by the hour. So if I give you a number now, it's going to be out of date in the next hour. But it's safe to say we're dealing with over 1,000 contacts, close contacts now.
With all the amount of restrictions that are in place and the number of people that are under quarantine right now, why don't we go into shelter in place?
Shelter in place is a stronger level of restrictions, Don, where we have right now. But effectively, shelter in place just says that it is illegal to leave your house and go somewhere else. where we are, we have to take into account that we're in a different position than where we were last year. We have treatments for the virus. We have mass testing. Last year, we did not have mass testing. We went into the shelter in place. There are different things. So we can deal with what we have and to identify. But the key point is that we have to slow the transmission and to give our health teams a chance to work. It is far easier to contact trace if you haven't gone anywhere. And so from that perspective, it makes it easier on the teams. And so that is the notice. People are not going to be going to work. They're only going to be going out for specific things. And that end, there are going to be far less places to go, with places of public resort and places where there is an increased risk of transmission indoors where masks are being worn. So I recognize the question. We discussed all the various options earlier today, and this is a decision that was arrived at.
At the current time, this is the highest number of active cases Bermuda has ever had. We've gone over 1,000 cases now in total. How close are we to the line then of going into shelter in place? You know, we've already got more than 1,000 people in quarantine.
If you ask the same question, I promise you won't get a new answer, Don. We are at the decisions where we are right now. We've laid out the indicators. We are at a dangerous place. And what is important is that over the next 2 weeks, people observe the restrictions that are in place. And if we find that we may need to take stronger action, then we'll do so.
All right, thank you very much.
Premier, we'll now go to the World Gazette. World Gazette, please go ahead.
Good.
World Gazette, you're live.
Yes, thank you very much. My first question, first, can you confirm how many of these new cases are the more dangerous COVID-19 UK variant?
Hello, we're dealing, right, I don't know the figures for today, but as of yesterday, we were looking at between 80 and 90% of the new cases were the variant originally detected from the UK.
Now, one of the other statistics that came out today is that we're currently 113 cases that are still under investigation. The source is not known. Is the belief that there are a lot of unconfirmed cases that are out there, or is it possible it's just a handful of super spreaders?
No, I don't think you can make that inference from that data. What it simply means is that these are people, oftentimes because we've not had enough time to be able to investigate thoroughly where they may have got the infection from. What we found over the last week and even with the previous outbreak is that given enough time, you are oftentimes able to link most of this. But to meet with the reporting schedule, we have to tell you where we are at. So I'm not sure, I don't think you can make the inference that you're making.
You must be on mute.
I can't hear you.
I'm sorry about that. We have had a lot of protections put in place to guard our seniors. Can you tell us how those have been playing this current pandemic? I mean, have there been a lot of cases among the elderly in this current batch?
No, is the short answer, and thankfully so. The mean age, as we heard from the minister's statement, is 33 today. So that's much younger than what we used to have in the past. So it's affected young people, younger people, I should say, mostly. But having said that, though, we are seeing a few seniors being affected at the moment. The other point to make is that the seniors that seem to be affected appear to be those who have not been vaccinated. So that is a thing of concern for us, because we know that outcomes are poorer if they're not vaccinated. So my message to everyone is, if you have not been vaccinated, please avail yourself the opportunity. We are now in phase 3. If you want to get vaccination, you can't get one, register and you'll be called to get vaccinated.
The next question will probably be for the Premier. Given that there are new restrictions that are being put in place, can you tell us the status of government services? Are there any plans to change or alter services for the public to help curb the spread of this virus?
Absolutely, there will be modification of government services, the details of which will be revealed. But what is the head of the public service will be communicating and heads of departments will communicate. But what is key is that the indication of which we had said that if you cannot work from home, if you are able to do your job from home, then you should not go into your office. That is where we are. So the Parks Department will be out doing their work with the items. But for instance, in office settings where there are individuals that will do it. So for instance, the cabinet is going remote, government is going remote. We need to make sure that we lead from example, and the government will be doing that as well. So in the exact same way as where we were in limited services, I want to say where we were in phase 2, which was the period around in May last year, it's around there. And so the schedule of public services will be published in that way. What we are trying to do is to minimize persons that are indoors. And when you're indoors, the message has to be for all persons to wear a mask. And if I may just pick on something that the CMO had said, because I think that it's important, that we need to make sure that people who are vaccinated recognize what this is. And it's not to say that, you've been vaccinated and, run around and do it. Follow the public health restrictions. There's a whole lot of people that are saying, why get vaccinated? I have to follow the same restrictions. Doesn't make sense. Those restrictions will be able to change once there are a larger portion of people that are vaccinated. But it doesn't mean that you get vaccinated all of a sudden, So there's people who are saying, why get vaccinated? If I have to follow the same restrictions, it is to get vaccinated so that more and more persons can get to the place where we can find a space where it will not be possible for our number to increase because there's enough people that are vaccinated inside of the population and go down. So I think that's an important distinction to make. And I think that it's very important that individuals still continue to practice follow the public health guidance, whether they are vaccinated or non-vaccinated, and comply with public health rules such as washing your hands and doing everything else.
Now, of course, with the number of active cases currently ongoing, contact tracing is obviously going to be a high priority for the government. Can you tell us, are any extra resources being put towards that? And what has been the sort of response? I mean, has there been a hesitancy to respond to those questions about where you've been and who you've been with?
We recognize that the contact tracing caseload has intensified tremendously. And in fact, following the last surge that we had, we were able to galvanize ourselves and add more resources to the contact tracers. However, regrettably, as has been stated, because of the high level of transmission with respect to this particular virus, they are becoming to be overwhelmed. Each case may have 25 close contacts. I was at a meeting this morning and one of the cases had 80 close contacts. So the case workers are obviously working overtime, which allows me, I think, as a segue to reiterate the position that the Premier made, and that is that these are individuals that are not only working enormous amounts of time under enormous stresses away from their families, but we can assist them by doing what we're supposed to do, which is with respect to the physical distancing and keeping our bubbles small and so forth, wearing our masks and so forth. We know that this UK variant spreads like wildfire. We're seeing it in Bermuda. We're seeing it from the last week, from 2 weeks. And the reality is all of this is preventable. And it's very discouraging to know that we have to speak and repeat ourselves day in and day out about what the public health guidelines are when some people just purely for selfish reasons are just ignoring it. And then the rest of us are all adversely impacted.
And I guess this would be my final question. Do we have any update on the COVAX vaccines? Last I heard, they were supposed to be arriving in the first quarter. Obviously, there's only a couple of days left in that.
Yeah, I can speak to that, Minister. So yes, we do have contact with the COVAX facility, and they have given us reassurance on the quantities of vaccines that we're expecting and a tentative arrival date. And there are a few questions that we need to iron out before we can confirm that and announce that. Until we're able to do that, unfortunately, we'll still have to keep a watchful wait.
All right. Thank you very much.
Premier, we'll now go to TNN. That's a slight delay, but he'll be on shortly. TNN, you're live. Go ahead with your question.
Good evening. Thank you for allowing me in. I want to ask about can you hear me?
Yes, we can hear you.
Yes.
Okay, yes. I want to ask about, is there any possibility of the supermarket, grocery store alphabetical order system being instated again?
At this time, it is not, and where we have is the restrictions of which we've laid out, and so no.
Another question being asked is unemployment benefits. Can it be applied for those that have not been shut down, like gyms?
Yes.
Would you consider this be okay? That just answers that question. Thanks. Would you consider this to be the most serious of numbers and such a quick rate? Would you consider this as a crisis we're in at present?
I would say it certainly is the most serious increase of which we've seen, and that was reflected in the Minister of Health's comments and my own comments.
I got a call here from dentist offices. What is the protocol for dentist offices moving forward? You give information about other facilities. What is the protocol for them?
Minister of Health?
Okay. Actually, I'm going to yield to the CMO on that one because obviously, if we're reverting to where we were previously with respect to May of last year, then certain emergency procedures obviously would need to be conducted. CMO, do you want to add to that?
Yes, Minister. So the details would need to be worked out with the dental council and our dental colleagues. This has to be a careful consideration of risks versus people who need emergency care. So certainly emergency care will need to go ahead. More routine treatment would need to be risk assessed before it goes ahead. That discussion needs to happen with dental council before we can make a public announcement.
Thank you. Another question I have from a few callers need to know, there are people being tested positive and not being informed by the Ministry of Health until a few days after their tests. Why and how can there be delays in informing positive results, in which resulted in various spreading like wildfire? Why are a lot of these people that are being tested are getting their results rather late, and they have been amongst lots of people?
However, when we get the result, we do receive the result information, and when that information is received at the epidemiology and surveillance unit, then all best efforts are made to contact the case. In fact, in 80% of the time, we have been able to contact the case within 24 hours of us receiving the test results. That's again in 80% of the time, and international standards, I believe, are a little bit lower than that. So we are surpassing international standards with respect to the time it takes for us to make contact. You have to also understand that in some circumstances, perhaps the individuals may have not had proper contact information that was revealed. They may not have data on their phones. There might be a number of reasons why there's a difficulty in reaching the individual. But again, I think of the most important element is that within 24 hours, in 80% of the cases, persons are contacted.
If I may just add to that, Minister. If I may just add to that, we are in contact with the Bermuda Medical Doctors Association, and we're certainly doctors' offices are taking on the challenge of letting their patients know when they've been diagnosed positive. So that is in support of what is going on with the ESU team, and that is going to be strengthened going forward.
Thank you. And my last question. It was stated that all schools are closed, as we do know. Why is it that teachers are still having workshops on Mondays if schools are closed? And another question, is this affecting nursery schools that are still due to be open on Monday?
Happy to speak to that. I believe that I'm not entirely certain what's going on regarding teachers, but I do know that professional development that was set to take place was going to be taking place remotely anyway, so I don't think that's an issue. In regards to licensed daycare centers, those have not been closed, and Minister of Health, I don't know if you want to expound on that.
Thank you.
No, that's correct. Licensed daycare facilities will remain open.
Thank you very much.
Thank you, Premier. There are no more questions from the media.
Okay, if I may then, just to recap, what's most important is people understand the new and revised outbreak restrictions that are coming into place. First of all, with retail and grocery stores will remain open with 20% of approved fire occupancy inside at any one time. Schools and camps are going to be closed. However, licensed daycare facilities, which have been licensed by the Ministry of Health, will be allowed to be open following strict public health guidance and will be visited by public health officers to ensure that that is taking place. Working from home now is mandatory. If you are able to work from home and do your job from home, it is mandatory, and employers cannot force persons to come into work if it is reasonably practicable that they can do their job from home. Churches are going to be closed for indoor services. However, persons may be able to enter the church to facilitate service for a broadcast, no more than 10 persons. Gyms and outdoor places of recreation are closed. Indoor gyms are closed. And other items which are indoors, such as bowling alleys, movie theaters, indoor museums, or indoor public recreation places are set to be closed. Outdoor activities, such as golf courses, tennis courses, parks, others, outdoor gym equipment, and outdoor activities are fine and be open. In regards to the issues of restaurants, indoor dining in restaurants are closed, except for hotels whose indoor dining is restricted to hotel guests only. And again, if outdoor facilities for restaurants, bars, and clubs are able to be open, and as previously before, the curfew is in effect from 11 p.m. until 5 p.m., and personal care services are able to be done on a very limited basis, as long as they do not require masks to be removed. That is what we have today. As I said, there'll be further updates, which will take place next week, Tuesday, at our press conference. I want to remind everyone, as much as possible, please ensure that you stay at home, do not contact others, do not go in contact with others, do not mix households. This is a very serious situation, but we can arrest it very quickly with the tools of which we have at our disposal if we keep to ourselves and minimize this rate of transmission of this virus. With that, I want to thank you very much for your help and assistance. Take care.
To the harbor buoys they glide, drawing seaward till they dip to the swirling of the tide. One by one, then two by two, down the channel's turns they go, alluring for the open blue, where the surfy gray airs blow. Craft